I will introduce Kelly Fernandes. Kelly Fernandes is a certified industrial hygienist and occupational hygienist at WSPS, bringing over 15 years of experience as a health and safety professional. Kelly excels in a variety of occupational hygiene projects, including worker chemical exposure assessments, indoor air quality and mold assessments, noise assessments, program development, and respiratory fit testing. Kelly holds a Bachelor of Science in Honors in Biology, a Master of Science in Environmental Plant Physiology, although she humorously admits to not having a green thumb, so I can relate there, and a post-diploma degree in environmental engineering. So Kelly is passionate about health and safety, and she's excited to present today and hopes you find this information helpful and empowering. So welcome. Thank you, Kelly.
Thank you, Kristen. Thank you so much for having me. I appreciate it. Just a thumbs up that we're good. You can see my screen?
Yes, I can see it. Yes.
Perfect. Okay. So moving along, just a quick disclaimer that some of these images are copywritten in this presentation. So quickly gonna go over the topics. Of course, we're gonna talk about who WSPS is, a brief introduction into chemical exposure assessments, and talking about some of the regulations. But the meat and potatoes of this presentation is really peeling back behind the curtain to see what goes into a chemical exposure assessment and diving deep into the sampling strategy and how that sampling strategy, that scoping, helps protect workers from occupational illness. And we're going to look at some safety data sheet and go through a little exercise, and then discuss what you could expect on an assessment day. And hopefully we have some time for Q&A. So WSPS is another one of the health and safety associations that make up the health and safety system in Ontario. Very similar to IHSA and WSN, we provide similar services. However, we work in the province with sectors, the manufacturing sector, agricultural, and service sectors to provide a variety of health and safety solutions. So we support our customers to help protect the workers and, of course, then meet health and safety regulatory requirements. Those requirements are there to help protect the worker, and that's our passion. We do this through a variety of services, such as consulting services, one of those being an occupational hygiene chemical exposure assessment, which we're going to be discussing today, as well as providing training, resources, tools to ensure that every worker goes home safe every day. And here's my most wonderful team of hygienists that provide services throughout Ontario. And each and every one of them has amazing technical experience, and their passion for health and safety, inspires me as well. So the purpose of this presentation is to share how occupational hygienists reduce occupational illness through exposure assessments. We will discuss a little bit more about an exposure assessment, but mainly we're doing that before the assessment, and how we develop the sampling strategy and how that assists in reducing occupational illness by assessing exposure to the worker. So exposure assessments, or sometimes you may hear them called air monitoring or air sampling, although it is so much more than that, is the detection and assessment of chemical agents to which workers may be exposed. The purpose is to determine the actual exposure levels and determine what controls may be required. So thinking back to Steve's assessment presentation, he's talking about noise and noise controls. Very similar, we want to implement those same controls to chemical agents. If you've ever participated in a sampling event yourself, maybe you've even worn a sampling train, you may recognize this first picture here of a pump with a tubing with a cassette attached to it. We call that a sampling train. You may also have found that an OH comes in, they set up their equipment, we collect our samples, and then we leave. And you may also have seen a report afterwards, summarizing what was done for the assessment. But I think we miss all the beforehand that comes, which we'll be discussing. So depending on the chemical agent that we're sampling, there's a variety of media and tools. So one example here being the cassette, but there's also badges that we may use, tubes to collect, and each chemical agent needs to be collected in a specific way. There are two main types of samples that we collect in the field. So one here, example is a personal sample where we're placing the sampling train on the worker in their breathing zone to collect the exposure for their work shift. Depending on the activity, we may also set up area samples, but our ideal preference is the personal sample. There's also real-time instruments that can be used to collect data. It collects it on a computer, and then we can download and analyze that later. So there are various regulations that could apply to your facility or project under the Occupational Health and Safety Act. I've listed a few here. Depending on the type of work that you're doing, there's different requirements, maybe to collect exposure samples or to determine the level of exposure to workers, even implementing a control program or having your workers go through medical surveillance. And these regulations are in place to protect you and meet regulatory requirements. So occupational exposure limits in some of those regulations. So for example, regulation 833, there are what we call occupational exposure limits that provides like the maximum level of exposure for a specific amount of time to which a worker can be exposed to a chemical or biological agent that doesn't impact or likely not to affect the health of the worker. And the ministry has also adopted some of these, some of the TLVs or the threshold limit values from the 2017 ACGIH guidebook. And those are also part of regulatory compliance as well. And then the third piece to that is there's also best practice guidelines out there. For example, the most recent ACGIH TLV guidebook. That's not regulated, but it is something that hygienists will use as best practice. And the three main occupational exposure limits that we use day to day, we call them TWAs, STELs, and ceilings or Cs. Time weighted average limit is the limit that a worker can be exposed in a day or a week. Short-term exposure limit is what it says, short, a 15-minute sample that a worker can be exposed to no more than 4 times during an 8-hour work shift with at least 1 hour in between the exposures. And then the ceiling limit, which is at any time the worker can be exposed. So it could be even a really, really short exposure that the worker can be exposed to. There are other limits called like excursion limits, or even, of course, IDLH, immediately harmful to life or to cause death, that we also may use. So before we even get to site to complete the air sampling, we need to get an answer to all these questions. We need to know the who, the what, the why, when, and how long we're doing the sampling. And many of us hygienists have created our own templates or a series of questions to ask this. And we will do this either what we call through a scoping call or a scoping site visit, where we go through the facility to get all the answers to all these questions. And we're going to get a little bit deeper into it. So, for example, this is a table that I use to gather information, and I will go over each of these, but I want to share how important this part of the sampling strategy is, or how important this scoping visit is in helping us prevent occupational illness. So this visit or call gives us the opportunity to get to know the site and even offer recommendations before we ever take a sample. So for example, I've been to sites where I see workers spraying isocyanates as an example. And even before I come to take a personal sample to determine the exposure, I can transfer the knowledge to the workers and to the employer about how to protect the worker and ensure that workers are, for example, properly using their supplied air, or that supplied air needs to be implemented to protect the worker. Another example is I've been to sites that have engineering controls or local exhaust ventilation, where the LEV, or the local exhaust ventilation, is supposed to be pulling the contaminant away from the worker's breathing zone. However, how the worker is set up within that space, it's actually being blown in their face and behind them. So right away, we can have that conversation and ensuring that we just change the position of the worker and the way the work is done to ensure that we are protecting the worker and that engineering control is being used properly. We also may identify something that isn't on anyone's radar. So I've been called in, for example, to look at dust in a facility where I realize that the hazard is really noise. My concern is the noise. And so, we'll do sampling for the dust and we'll do sampling for noise. And the dust was well below regulatory limits, but it was the noise that was really the concern. And so we're able to help guide the employer and the workers to ensure that we're protecting them from, like Steve was talking about, noise-induced hearing loss. So I'm just going to quickly go through my list here. So in order to answer some of those questions that I had on the previous slide, I need to know how long the shift is. Shift start time, I need to show up on time to ensure that we're getting the samples on the workers. Are there any ministry orders that we should be made aware of? We want to ensure that we meet the requirements of those orders. And then the bulk and potatoes is trying to build that sampling strategy and understand how and when we're going to sample. So we need to understand what processes you have on site. Do you have welders? Do you have someone assembling? Do you have someone painting? We're then going to group those workers into those individual exposure groups and figure out how many workers are in the facility or doing those tasks, learning about the tasks of each group so that we know, oh, is it something they do all day? Is it something that they do that snapshot? So you can tie it back to, okay, time weighted average all day, or a ceiling limit is that snapshot. As well as within those tasks, determine what products they're using so that we can ensure that we are capturing the right chemical agent that could potentially they could be exposed to. And then also we're looking for those controls that are in place. What controls are in place now? Because part of the assessment isn't just collecting an air sample, it's to determine that the controls are in place are effective, that they are working. So hopefully you're starting to see the connection between, okay, what to sample. We need to know what processes, who is doing the work, when to sample, how long to sample, how many samples, how all of this information gets collated so that we can develop a sampling strategy. And now let's do a little example. So once we've gathered all of the information, we can start to look at what to sample. So for today, we're going to use an example of a worker pouring products into an inking process or inking machines. After we've gathered all of the information and I understand the process and the task now of what this worker is doing, I need to know, what is that product? What are they pouring? And so I'll ask for the safety data sheet so I can look at the ingredients. And there are other situations where I may not need an SDS, or just from experience, I know what to sample. Like, for example, if I walked into a bakery and they're using wheat flour, I know that I'm going to sample potentially flour dust or general dust, inhalable and respirable particulates not otherwise specified. That's a fancy way of us saying dust. We like to use our fancy words as hygienists. So we will look at the ingredient lists and look at like the CAS numbers and the percentages to help us start guiding us of what we should sample. And now, now that I have that information, I need to know, how am I going to sample? So I've identified that I'm going to sample for propyl alcohol and propylene acetate, but how long am I going to sample, what tools am I going to use. And so the next thing we may look at is occupational exposure limits to help us decide. So looking here, you can see that propylene alcohol has a time-weighted average limit, but that N-propyl acetate also has a short-term exposure limit. So for that particular agent, I want to, this worker is doing this task all day. He is going to different machines and pouring this product. So I'm going to want a long-term sample on him to cover the majority of his shift. But then I also want to look at the specific task that he's doing. And in my example, the task of him filling up the machine takes about 15 minutes. So I definitely would want to put a short-term sample on this worker to capture that task as well, and to compare to these occupational exposure limits. So I'm starting to build my assessment. And for example, what if this worker did this task for 15 minutes or a day, or only did it a few times? Another option would be to take those shorter 15-minute samples and then calculate the time-weighted average, what the average would be over the whole day. So we also need to determine how we're going to collect the sample with respect to the methodology. So the regulation gives us clear clarity on the types of methods we should be looking for. For the most part, we end up using NIOSH and OSHA to collect our samples. And there's an example here from NIOSH on how to collect the sample. So continuing with this example, the method gives us clear instructions on the equipment we need, the media we need to use, even the flow of a pump, or the use of a badge, and the length of time. Even the length of time, it may have a restriction. We may only be able to get a certain amount of time, so then we have to collect additional samples throughout the shift. But even after all of this, we also assess risk. So we can't sample everything potentially in a facility all at once, or it may not even make sense to sample something, especially if the agent isn't airborne or there isn't another way for the worker to be exposed. So we have to prioritize, and we want to focus on the highest risk. And so we have various tools that we may use, but there's also a tool available to everyone that even you can use, and it's called the CHAP tool, or the Chemical Hazard Assessment and Prioritization. It is available online. I do have a link to it later, and it will be shared on the website once this is posted. And you can put in all the information regarding the product. So continuing with my example, pouring product into the ink machine, I entered in my product, and it can do up to 10 products at a time to help you assess that risk. So you put in the information from the safety data sheets, so the hazard statements, if it's a liquid, temperature, how much the worker is using. And when I get to the end, you can see in the bottom where it says result, it says RL4, which is very high. So obviously this is going to be part of my sampling strategy. And you can put in more products. I just collated 2 here just to show the difference. So I definitely want to sample product 1, but maybe product 2, since it has a lower risk, I'm not going to include that. Assume I would definitely probably have more products here than just 2 to sample, but that would be lower on my sampling strategy, but I want to sample that first product. And you can see here that there's some recommended control approach. So the special one, essentially what that means is reach out to a hygienist to help you assess and control that hazard, which means doing the chemical exposure assessment and ensuring that the controls are effective. So speaking of controls, Steve brought this up in his session. So I just wanted to go over some examples. I will be very quick. Going through the hierarchy of controls. So Steve talked about elimination and substitution. So similar to chemical exposures, can we remove that product from our facility? If not, could we substitute it? Maybe instead of using that particular product, maybe a water-based one that doesn't have the same hazards could be used in the inking machines. If not, then we want to look at our engineering controls. Few examples I have here. I have a worker cutting with some water to keep the dust down, and the worker on the top, there's a there's a HEPA vacuum attached to that that takes the dust away from the worker. You see here that these workers are still wearing PPE. Depending on the controls that we have in place, we still may need PPE, and we'll get there. Next is awareness and administrative controls. So that training, the training piece that WSN and IHSA and WSPS do can be part of the controls. And then last but not least, we have personal protective equipment. And this is another piece to that exposure assessment that we also assess. So a lot of times when we talk about chemical exposure, of course, we think of air exposure, but there are other ways. So we also want to ensure that, for example, that worker that was pouring, what if they weren't wearing gloves and short sleeves? They potentially could get exposed through their skin. So we want to ensure that they're wearing their gloves, that their skin is covered, that the gloves are correct. So we will also assess that information in our chemical exposure reports. So it's so much more than just air. We're assessing the controls that are on site all the way from engineering to PPE. And the last piece I just wanted to remind everyone, if you're familiar with the hierarchy of controls, is that we have that decrease of effectiveness. You can imagine if I eliminate the hazard from my site, that is going to be a lot more protective than a personal protective equipment where it may fail or the worker isn't using it correctly. Steve brought up a great point about hearing protection not being worn properly. When worn properly, it can protect the worker, but if not, it's not going to be as effective. Similar to respirators, the right pair of gloves, all of it. So, what to expect on assessment day? So, after all of that stuff that we've done in the background and maybe already provided recommendations before we show up on site, when we do show up on site, we want to invite the joint health and safety worker representative to be there at the beginning of sampling. They can ask any questions that they may have, or even help us maybe make some changes on sampling day. Maybe there's something that we wanted to focus on, assuming that we have the equipment that we need, and we may make some adjustments, or production is down in one area. Okay, tell us another area that would be similar. We have this similar discussion with the workers and learn about their tasks in the areas and explain to them what they're going to be wearing for the day. We observe the work, observe the tasks, review the controls, and of course, we do our sample checks. We need to ensure that the sample is not covered up. For example, if my hair is covering up the badge, I want to ensure that that's not happening. Of course, my hair should be tied back, so that's a really bad example, but that, the equipment is running, the pumps are running, that everything is proper. And we also want to capture most of the shifts. So the worker will be wearing the sampling train for a majority of their shift. We may not be able to capture all of it just because of setup and teardown, but we try to capture at least 75% of the shift. And that's even if the shift is not 8 hours, we're going to then sample longer to capture. We want to ensure that we're getting that representative portion of the shift and a representation of the tasks that the workers do to get that exposure. And similarly, for the short-term samples, again, we want to ensure that we're capturing that task. I'm not going to put the short-term sample on the worker while he is inputting information into his computer. I'm going to ensure that that is on him when he is pouring and dispensing. And I have a list of tools here and resources that are available. Similar to IHSA, we have a bunch of resources that you can access on our website, and the links to the CHAP tool. I also provided a link to the table, the current occupational exposure limit table. So the one that you may know in the green book is shorter than the full table, but you can access it here, and we'll post that as well. And then some information on the e-laws, and another good resource is the ministry website as well. I provided my email here. If you have any questions, please reach out to me. And last, how can we help? So, of course, we can do occupational chemical exposure assessments, noise assessment, indoor air quality assessments. That's more focused to office spaces. We do designated substance assessment. We have some prepaid projects and resources as well. So in line, similar to IHSA, we're doing a silica program right now for customers in manufacturing countertop, and we're collaborating with OCal, which is fantastic, to provide services to ensure that those workplaces are compliant and protecting those workers. So if you have any questions about that, also please reach out. And we do respirator fit testing, of course, any policy or program review or development, and training as well. And on the website, we have lots of free resources. We also have podcasts and safety connections that can connect everyone. And that is all for me today. Thank you. Thank you very much for your time and attention. I really appreciate it.
Oh, thank you so much, Kelly. That was so good. That was like everything you wanted to know about occupational hygiene sampling, but we're afraid to ask. That was so good. That went through it from start to finish. Thank you so much. Okay, so I know we're just after 1:30. I know we put the link in the chat already for those who had to go right at 1:30. It is there. You can scroll up to find it. Kate, if you would just post it one more time. So I want to thank Steve Gore, Jennifer McKenzie, and Kelly Fernandes from Kelly Workplace Safety and Prevention Services, Jennifer from Infrastructure Health and Safety Association, and Steve from Workplace Safety North. Do we have any questions for Kelly? Just hopefully quick ones, noting the time, but we can put you in contact with Kelly. If you have a longer question, you can use the form to request that as well if you didn't catch her email address. Okay, I'm going to turn this over to Kimberly.
Thank you. Listen, I will not keep us any longer today. It is just such a pleasure for me to thank the team that put this October and Beyond series together. And I'm not going to name the names. You see them in front of you today because I'm going to forget somebody. And it is such a big team being led by Krista and so many others. And I hope that you take home over the series, you revisit the series, you find impact in your workplaces. And as many have noted in many places with me, I have a dream to empower workers to all be working on their occupational health. Some would say a little bit trying to turn the world into hygienists, but that really is another way of saying that. And I just wanted to thank all of our speakers throughout the series, our leaders, our researchers, and I hope that what we are conveying is the partnership and collaboration to empower workers to protect themselves and to get home safely and healthy. And yeah, thank you.
Okay.
Wonderful.
Thank you.
Sorry, Krista, I didn't really end that like with an ending. I just said thanks.
That's okay.
Okay.
It works.
It works. All right. Have a great day, everyone.